Effective Injury Prevention and Risk Management Proposal, presented by Noah Fitzpatrick and Madison Wingo. Here we go.
Our setting is going to be in a sports medicine clinic where we're going to have occupational therapists as well as athletic trainers, and this will be specifically for the population of recreational athletes. As you may know, athletic trainers have a wider range of abilities that fit into their scope of practice. They are able to recognize conditions and recognize injuries, to be able to evaluate their injuries and also diagnose for further care. As an athletic trainer, they can also be a part of rehabilitation and therapeutic intervention. In a rehabilitation clinic, they'll be able to collaborate with PTs and OTs that will help design the functionality of therapeutic interventions with programming, specifically for the athlete's goal in mind of returning to sport. Therefore, athletic trainers can be in a unique situation before and after the injury of the athlete, and allows for their profession to grow in injury prevention and therapeutic interventions. Athletic trainers have the ability to diversify their work environment by working in a sports medicine clinic. As you guys may know, ATs are notorious for working nonstop, and working in a clinic setting will increase their salary, decrease their hours, and also increase their career development. The NATA wants athletic trainers to work in a variety of healthcare professions. They can develop their skills for a patient by assessing activities of daily living and facilitating functional rehab, which enhances their ability to help athletes in all areas of life. Rehabilitation includes short and long-term goals, and are enhanced by a lot of functionalities, and these daily skills can be rehabilitated in occupational therapy holistically to prevent setback or re-injury.
Organization and administration of healthcare program. So for our facility, we're going to make sure we have proper documentation and organization. All the paperwork is going to be orderly. So first up, for documentation, we're going to allow walk-ins, and of course everybody who receives care or treatment is going to sign in to a treatment log, and then there's going to be physical examinations with orthopedic screenings to see what's wrong with the patient, and then they're going to have to sign treatment logs. So this is just to document an injury log, to document the treatment they're getting and any injuries they're working with. So another thing to consider is the budget and equipment needs. So we're going to have a budget to spend money to know what need. So I've looked up a bunch of equipment that we're going to utilize. So it's going to be stuff like therapy tables, skeletons, some with muscles, some just to show the bones, ice machines, equipment storage lockers, and closets such as the one in the middle photo. Exercise equipment including mats, dumbbells, resistance band, treadmills, stationary bikes, physio balls. So yeah, I've included a lot of visuals and illustrations so you can see exactly what I'm talking about. And it's all going to come out to about $16,000. So that's our budget to work with. Legal liability and insurance. This is mostly covered in chapter 3 of our textbooks, Prentice 2019. So some risks or legal concerns to be aware about is liability, negligence, torts, and such as malfeasance and misfeasance. So this is just knowing the scope of practice that you work in. So this can all be avoided by only working in our specific scope of practice. Like you've seen that we're going to have different roles: OTs, occupational therapists, athletic trainers, etc. So as long as we're doing what we're qualified to do, we're going to be good on those concerns, not put anybody at risk. So another thing is that clients will sign liability waivers, not holding us liable for any harm done to them. And then as us workers at the facility, we're going to sign personal liability insurance and have professional liability insurance. So this is going to protect us and our property from damage done to our property or to any harm on the property, so within the facility. So just by having this insurance, keeps everybody safe and insured.
Our textbook overviews acute injuries caused by trauma. In a clinical setting, acute fractures are not going to be seen as often since the rehabilitation process is short. A ligament sprain is going to be more commonly, more specifically, a grade 3 sprain is going to be a longer process of rehabilitation due to the nature of the injury or even possibility of surgery. And this could be a complete tear that results in severe swelling or pain or instability of the joint. The goal in a clinical setting would be able to strengthen surrounding muscles, increase muscle tension, and restore stability. Adrian Peterson is an example of an acute injury that disqualified him from football for 10 months. Through rehabilitation in a clinical setting, he was actually able to display a mindset of wisdom and future-oriented goals with a MCL and ACL tear in his left knee. So the healing process was accepted the way it is, which is pretty unique. And he was able to not let this long process keep him from taking step backs into getting back onto the field. So his 10-month recovery was actually seen as superhuman because of his drive and passion and confidence and positivity to listening to his body when he needed rest, but then also pushing himself to dominate the field one day again. Chronic injuries are common from repetitive movements, and this would be common in the rehabilitation setting with tendonitis. This is an inflammation of the tendon that occurs during muscle contraction, and it's very important for the athlete to stop activity. As the healing process will slow down, to return to full activity, it must not inhibit optimal healing environment for inflammatory response and all the things that go along with healing the scar tissue. Chronic injuries are very common among young athletes because of their hourly participation in sport, and this leaves less recovery time for tendons and muscles to heal, leading to greater repetitive movement. So younger athletes are left with no choice of playing through the pain and requiring time away from sport, which is a hard choice. So this study identified the most common overuse injuries in athletes from ages 5 to 18, and this was caused by microtrauma. And so this knowledge allows us to understand chronic injuries and can be beneficial for injury prevention, especially in pediatric athletes. We could see in a clinical setting that environmental factors can still play a role in recognition of injuries. We want to be able to identify the signs and symptoms to be able to prevent tissue damage. The NATA position statement has regulations to prevent cold-related injuries, and we can see that clinics should have readily available equipment and supplies that prevent cold-related injuries from preventing any more damage than it has already done. And so we need to be able to stock with these supplies and make the best decisions for the future of the athlete. And recognizing this can impact an athlete's career and is essential for immediate treatment.
So injury prevention. So you can prevent some injuries through fitness, and that's just by increasing flexibility, posture, as well as strength, endurance, and body composition, and then nutrition as well. So the more in shape you are, the healthier you are, the less likely you are to become fatigued, and a lot of injuries happen when we're fatigued. So it's important to know these things. Posture can also lead to injuries, just having bad posture for a long period of time. Modalities can help prevent injuries such as prophylactic taping or braces. You can wear knee braces, elbow braces, ankle braces. You tape any old injuries or anything that has pain to prevent further injury. Proper warm-up, so this is the ramp protocol, just making sure that heart rate is elevated and the body is ready for exercise. And then you can also improve biomechanics and technique. So in anything you're doing, as long as you have good technique, you're doing well in preventing injuries. With poor technique comes injuries. Another thing is that equipment should fit properly to help ensure a safe environment. So helmets in football, shoulder pads. You want to make sure this all fits properly, otherwise resulting in improper can cause injuries when you're hit. Footwear, shoe problems, ankles, cleats can also cause pain, blisters, plantar fasciitis, discomfort, etc. So, moving on.
This non-traditional sport of acro and conventionally circus is a very unique sport where chronic musculoskeletal injuries are most common to be occurring because of the nature of falling or getting caught or twisting or even overstretching. The combination of power and hypermobility tests the muscle's capability of stabilization, and we can see that a lot through many other mechanisms. So, to be able to ensure safety for all performers, we want to be able to prevent these common injuries from happening. Workload should be managed, and we can rotate artists. We could make sure we have appropriate equipment up. We have to adapt to certain skills. And just take respect for one another's body. Before the show, the athlete must be able to have a healthy sleep habit and have a proper warm up, which is very important to preventing injury. And we can also see that a well designed strength and conditioning program is going to be able to benefit the athlete by strengthening those muscles so we don't compromise stabilization.
So some sport coaching examples for the 110 and 100 hurdles. So I put the 110 and 100 because men and women run different distances. Men run 110 meters and females run 100 meters. So with this, the most common injuries include a groin strain on the trail leg as well as the lead leg, and then a hamstring strain on the lead leg. And then after those, some other common ones are shin splints and tendinosis, and then strains in like the calves. So the reasons for these injuries are the rapid stretch of the muscle, and when the muscles are tight, that's going to cause it. With technique, it's going to mess up the groin on the trail leg, so the follow through can be too late or too wide of the trail leg, and that will lead to a tear or a strain. So also for shin splints, it's going to be repetitive training and just the switching of surfaces from asphalt to grass to turf or weatherproof track. So just switching that a lot is going to cause pain to the shins. So for prevention plan, we're going to include a proper warm-up and include dynamic stretching. That's going to help elevate the heart rate, warm up the muscles, and get the blood flow going. So it's also going to loosen up the muscles and going to help. Another way to loosen the muscles is with foam rolling or myofascial release. So that's going to be pictured in the bottom, the guy laying down on the foam roller. So that helps break up those fibers, not too tight. And lastly, strengthening your lower body muscles with eccentric exercising. So like Romanian deadlifts, Nordic hamstring curls. It's going to help prepare the athlete. Integration of faith. So our Christian worldview on this. So we're called to love one another. It says it in Matthew chapter 22, and you shall love your neighbor as yourself. So loving your neighbor can include treating injuries, providing rehab for those who are injured. So just generally improving the lives of others. Another verse that can capture what we're trying to do here is Hebrews 13:16. Do not neglect to do good and to share what you have, for such sacrifices are pleasing to God. So just doing our careers, athletic training, occupational therapy, that can be pleasing to God because we are sharing what we have with others and helping them just their entire lives. So another verse found in Matthew is going to be, give to the one who asks you and do not turn away from the one who wants to borrow from you. So those people are going to be in need with injuries or pain, and we're going to treat them as we're treating God's children. So we're just going to be trying to fulfill God's command by doing our work, our just daily careers. So there you go.